Everywhere as the COVID surge continues, that hospitals will max out and sick and injured people won't have anywhere to go for treatment. It's a very serious one in Missouri, where the U.S. Department of Health estimates more than 84% of ICU beds are occupied. The death toll there now stands at more than 4,000, and hospitalizations are up 60% over the past month. That's according to the COVID Tracking Project. NBC News went inside DePaul Hospital in Bridgeton. That's half an hour northwest of St. Louis. Doctors and nurses tired and overwhelmed as the dead keep piling up. NBC News' Ellison Barber is live outside the hospital now. Ellison, you spoke to nurses there. What did you hear?
Yeah, well, Shepard, right behind me, I want to show you it is a triage tent they have set up outside of the emergency room. The hospital hasn't used this yet, and they are hoping they don't have to. But inside, they say their resources are stretched incredibly thin. We were able to go inside and be on one of the ICU floors. Many of the patients on that floor had COVID-19. Many of those COVID-19 positive patients in ICU were sedated. We saw them having to flip patients from their stomach or onto their stomach to put them in what's known as the proning position, because it was the only way for them to get oxygen into their lungs to keep breathing on their own without the help of a machine. We saw other patients who were on ventilators, but not all of the patients on that ICU floor had COVID-19. There were some non-COVID patients. Other emergencies are still happening even as COVID cases and hospitalizations continue to rise. And we saw that firsthand when a non-COVID-19 patient coded on the ICU floor. We're going to show you this video, and it is difficult, very difficult to see, but we want to show it to you because it is important to understand the reality of what these doctors, these nurses, healthcare workers inside this hospital and so many hospitals like it are up against.
I use the break, ultrasound.
Everybody clear? Once, twice, three.
Yes, shot. We're doing CPR.
Papa, are you doing recording, or do you need to do stuff in your rooms?
Hospitals do not have unlimited resources. When we're talking about hospitals hitting capacity, we're not just talking about physical space and the amount of beds that they have available. All that matters, but what also matters is, do they have the staff to take care of patients who need those beds? And what we're seeing in many places is that they are running low on staffed ICU beds. The doctors, the nurses, all of the healthcare workers here, they are exhausted. They are working so hard, and they are seeing so much death, and all of it 9 months in is taking a heavy mental toll.
Unfortunately, we're not seeing a lot. Once they get to us, we're not seeing a lot that make it out of here.
How many patients have you lost?
I don't even know our numbers. There's days when it's 3 and 4 a shift. So it's hard. It affects everybody. We just kind of have to pick each other up and move on to the next room.
This hospital has seen so many deaths in the last week and a half that they had to bring in a temporary refrigerated truck to serve as a temporary makeshift morgue at the end of last week. And Shepard, we are told that right now that temporary morgue is being used. Shepard.
Ellison Barber, thank you. Shepard Smith here. Thanks for watching CNBC on YouTube.